going to turn the recording on, and we should hear noise. Oh, seems to be on. Okay. So welcome everyone for joining us today. I have to say I am extraordinarily thrilled that we are offering this webinar. And that's because the survey redesign that David and Fadumo are talking about today is literally the outcome of something I worked on for a decade, starting in the year 2000. And so to see that work come to fruition is really exciting. We worked originally to try and get a redesign legislatively, and ultimately we ended up getting it through an administrative process instead, but we very much wanted better data for state child advocates to have, data where you could break things out by state, data where you had data annually instead of every 4 years, data that asked better questions about child well-being. And so to see this happen is just thrilling for me. I'm going to tell you one reason why, which is something we used when we lobbied a lot, and then I'm going to turn it over to our speakers. We spent a lot of time advocating for this, in part because we felt that if you got data every 4 years, that was not really helpful. And actually I did more than a decade because I was still working on this in 2011. And one of the points that we made to lots of people was that if you had data from 2007 and data from 2011, you had no data on how well children were doing in the depths of the recession. You got data from before it, and you got data when we were already coming back. And that really resonated with people, and it really is an important reason for having data, you know, consistently and not just every 4 years. So I am really thrilled to be able to offer this to you, and I myself am looking forward to the specifics of how it finally got reworked, because I only know the broad outline. So I welcome you all to this webinar. I hope you learn a lot about how to incorporate this into your work, and I'm going to turn this over to David and Fadumo.
Thanks, Deborah. This is David Murphey at Child Trends, and my colleague Fadumo Abdi. And between the two of us, we'll be presenting the webinar. And I think we can move right along into the next slide. So we're going to talk a little bit about the historical background, as Deb alluded to, the redesign, give you an overview of the survey, talk a little bit about the methodology of data collection, touch on some of the topics which really cover quite a bit of ground in the National Survey of Children's Health. It's called the Survey of Children's Health, but in fact, it really includes items that are much broader than simply health, as most of us understand that. And then we'll do a little hands-on demonstration using the online portal to show you how easy it is. I think in contrast to many other federal data sets, how easy it is to access this information. And of course, we're going to save some time for questions and answers. So let's go ahead and move to the next slide. And the next slide after that. So as I said, we'll start with a brief overview. The national survey, or the survey as we know it today, started out as two separate surveys. One was called the National Survey of Children's Health. The other was called the National Survey of Children. National Survey of Children with Special Health Care Needs. It's a mouthful, and that's why the acronyms. The one collecting information on children with special health care needs was actually first out of the gate, was first fielded in 2001, and the National Survey of Children's Health was first in the field in 2003. But in the most, as of 2016, the two surveys have been combined. And so we are collecting data in the redesigned National Survey of Children's Health both on all U.S. children 0 through 17, and then some additional information, particularly on that group, on the subgroup of that, who are children with special health care needs. And let's, you can see that last slide was sort of comparing the characteristics of the two surveys as they were at the beginning, but let's talk about the motivation for the redesign. So what we had, and this is, a lot of these issues are not unique to the National Survey of Children's Health, but to really any survey collection, we had declining response rates there for a variety of reasons, which we'll touch on in a minute. We wanted to try a new sampling approach, a new data collection approach, as I said, with partly as a cost-saving measure, but also just simplifying things. Wanted to combine the two questionnaires and add questions that reflect emerging issues. I mean, there are always things that one wishes one would have included in an earlier version of the survey. And of course, in today's world, things move very quickly, and there are numerous topics that people weren't talking about 10 or even 5 years ago that there's a need to collect data on. So I think we can move on. So specifically, as of 2016 and continuing into the latest year of data release, which is data from collected in 2018, I will highlight what some of those changes have been. So instead of a survey sampling frame that was based on landline or cell phone numbers, the survey has moved to an address-based sample, similar to the sampling frame used by the decennial census and the American Community Survey. And this was due to a number of factors. It became very problematic to collect data through using lists of telephone numbers. So many people were giving up landlines and converting to cell phone only. Phone numbers, as you know, are no longer reliably associated with a given geographic area. I have a 202 area code still on my cell phone, but I'm currently living in Philadelphia, as just one example. And then there were increasing costs involved in having to make multiple callbacks in order to reach people, because many people don't answer their phones, or they're very selective about who they answer to anyway. So long story short, it became increasingly problematic to use that as the basis for the survey. And so we moved to an address sampling. There's limited follow-up with telephone calls if people don't respond to the initial contacts. And the data are now collected using primarily the internet. So many people have access to the web now, and the relative minority who do not have good access to the internet, and there's still a sizable minority, they do have the option of mailing in paper data collection instruments, and as I said, there is telephone follow-up to encourage people who are not responding or responding late to get their answers in. As I said, the population is children birth through 17 years old with and without special health care needs. The survey, which used to be which used to be fielded every 4 years, is now out in the field annually. So it's an ongoing survey, and the numbers of households that are eligible to participate in the survey makes it possible to produce national level estimates every year, and state level estimates are more reliable if we can amass 2 years of data. So you'll see later on in this presentation how when it comes to looking at state level data, typically 2 years of data are combined so that we get a larger sample size, so that the most recent data set that folks will want to access will be data that combines 2017 and 2018. Now, I want to say that there were new questions as well as part of this redesign. Capturing, I'll give you just an example of some of the emerging issues. So the National Survey of Children's Health now has data on food insecurity for every state and the District of Columbia. It has data on flourishing indicators for both younger kids and older kids. For those of you who have been in this business a while, you know that most indicators that we track on the well-being of children tend to focus on negative events, the bad things that can happen. So we track low birth weight, and we track high school dropout, and we track use of drugs and alcohol and so on. And far less often do we focus on the things that are going right for children, or the positive choices that kids are making. And so the National Survey of Children's Health, I think, is one of the few regular sources of data for all children across the U.S. and for every state on some of the positive things that children and children within families, in terms of positive family activities, parents and children together, are doing, like eating meals together, reading together, talking about family issues. Those kinds of things. We'll be alluding to some of those later in the presentation. And then we also have within the National Survey of Children's Health items since, I believe since 2016 on adverse childhood experiences. Many of you will be familiar with that term. We're talking about the kinds of events or exposures in a child's life that can lead to toxic stress and all kinds of other health and well-being problems if they're not properly addressed or buffered by the presence of a supportive adult. So we're talking about things like having ever lived with an adult who was incarcerated, or a parent who died, living with a household member with a mental illness or substance abuse problem. Those are some examples. So those data are also available in the National Survey of Children's Health for every state and for the United States. So let's move on. I'm going to cover quite a bit of ground here, so I want to give ample time. So you can read on this slide the goal, the stated goal of the National Survey of Children's Health and its sponsors. This is a survey that exists because of your tax dollars, and it's been in good hands, I think I can say fairly, ever since the beginning, back in 2003. And we can move on to the next slide. As we've said, it provides representative data not only for the nation, but for all 50 states and the District of Columbia. The respondent is a parent or other knowledgeable caregiver. It's important to keep that in mind. Parents are usually very good reporters about their children. There's probably no other person other than the child, him or herself, who knows better what life is like for that child. But it is like any other way of collecting this information. It comes with some limitations, and it's the parent or other knowledgeable caregiver who is reporting on the child in the household, and it's important to remember as well when we're talking about the results of any of the survey items that the unit of analysis is the child. So we have to be careful not to talk about the percentage of families or the percentage of, or the percentage of parents, but rather the percentage of children, because that is the unit of analysis that the survey is designed around. One of the other features, or some of the other features of the survey are that the items on it deal with characteristics at the child level, at the family level, and at the level of neighborhood. So we have measures that are specific to the well-being of the child, but also to circumstances of his or her family and characteristics of their neighborhood. And the National Survey of Children's Health is a valued source for a couple of major federal assistance programs, the Title V Maternal and Child Health Services Block Grant, and there are also measures that are in sync with the national outcomes measures and other projects of the federal government we'll be talking about in a little while. So let's go ahead to the next slide. And I'm going to say here that I think it's used in, the data are obviously used by researchers such as Fadumo and myself at Child Trends and our many colleagues. They're used in federal and state level planning, and they have informed the Healthy People 2010 as well as the upcoming Healthy People 2020 objectives. We can go on to the next slide. I talk a little bit about the data collection process. So as I said, there's a mailed invitation initially to households, and eligible households are determined through a screener, which determines whether they have a child who is under the age of 18 living at home. They're also further screened as to whether they are a high internet use household or a low internet use household, and that determines whether the survey is going to be, they're going to be offered the survey over the web or through an alternative mode. And if there are multiple children in the household, one child is randomly selected to represent the household. So we're collecting, generally speaking, data just about one child in the household, although there is demographic data collected to understand for each household how many total children are living there, but the extensive data are collected only on a single child. So let's move to the next slide. Several groups of children are what we call oversampled. These are children under 6 years old and children with special health care needs, and the motivation for that is that these two populations are generally underrepresented in other household surveys. So what it means in practice is that if a household has a child with special health care needs, that child is 80% more likely to be selected as the primary child of the household. And if they have a child who is under 6, they are 60% more likely to be chosen as the primary child in the household to be the subject of data collection. So this is a way to sort of tweak the methodology to make sure that we get adequate data on groups that have been traditionally underrepresented. I think at this point, if I'm not mistaken, I'm going to hand things over to my colleague, Fadumo, who's going to walk us through some of the next slides.
Okay. Hi. Thank you so much, David. Sorry. Thank you for that wonderful start. So as we've discussed, the NSCH aims to capture a large trove of unique data about children and their families, as well as the Title V grant. So in the next few slides, I'll walk through the content map of the child and family level measures, as well as the grant measures. And the purpose of the content map, as we'll see shortly, is to orient us to what the topics, the dimensions, and the measures or indicators that the NSCH captures, and as well as to orient us to the Data Resource Center, which we will be going through shortly as a part of the demonstration. So some of the general topic dimensions covered by the NSCH are family and child level demographics. As David mentioned, a parent or a guardian fills out the survey. However, the information is collected about the child, and then questions are sometimes asked about the environment that the child lives in, including family and neighborhoods. And so as a result, we have also the topic domain of neighborhood safety and support, family health and activities, and things like emotional and mental health. So next, here is an example of a content map. This one is specific to child and family level measures. We will see this shortly when we are on the Data Resource Center website, but just to orient us now to what it looks like, we can see a title, the years of the data that this content map is for, and then the topic domains, and then the specific categories that fall under, the specific indicators that fall under each measure domain. The grouping is quite helpful for a lot of reasons, core among them, kind of orienting us to the Data Resource Center. And now we can look at a few of these examples a little bit more closely. For the first, we can look at what indicators fall under emotional and mental health. So here we can see that the indicators capture a number of mental and emotional health measures, including bullying, flourishing, and then specific prevalence measures of ADHD and autism, diagnostics, the severity, medication, and then treatment levels of them. And then I think another important thing to kind of bring to your attention is that these indicators, which we will be exploring soon, are vary sometimes for who they are measured, so for what age ranges they're measured. So for example, if we look at the two indicators 2.3 and 2.4, they are both flourishing measures. However, 2.3 focuses on 6 months to 5 years, so that's children, and then 2.4 is for 6 to 17-year-olds. And I think that's an interesting and unique thing that we can and useful too for when we are looking at different populations, because flourishing might look different for these populations, and so that's important to capture. The next one that we are going to look at is the family health and activities measure. So here we see various other measures relevant to the parents, family, sociodemographics, and well-being, and how well and how the child spent their time. And so this includes physical and mental health for both mother and father, the time that is spent with a child, what the child spends the time doing, and then at the bottom we can see sociodemographic characteristics like food insufficiency and whether food or cash assistance was received. And as David mentioned, the NSCH is unique in that it is a data source that captures annually adverse childhood experiences. And so that is indicator 6.13. And then finally, the other example of a content map we can just sort of survey really quickly is a content map that shows us the national performance measures and outcome measures of the Title V grant. And so again, this is for data that was collected at the state level in 2016 and 2017. And we can see that some of these performance measures and outcome measures mirror some of the child and family level measures. So for example, we see physical activity, bullying, autism, and ADHD. let me see. So next, I just sort of like we've mentioned a few times, there are a few unique contents that that the NSCH captures, and this is something that I think David has already touched on. So this is ACEs, flourishing, and at the national level, the healthy and ready to learn, which is a composite measure. So next, we are now ready to move on in the time that we have left to the demonstration for the Data Resource Center. So I will walk us through this, and my goal at this point is to introduce you or perhaps provide a reminder to the Resource Center, which is a project of the Child and Adolescent Health Measurement Initiative. The DRC houses the NSCH data and offers user-friendly access to data and easy-to-use analysis. So by using the DRC to explore available data, hopefully this exercise will inspire and empower you to use the center for your own research and work. So I am now going to get out of the presentation and go to the website. So just first to orient us to what's on the site, when we first go to childhealthdata.org, we can see up at the top that we can request data. Here is the option to explore the data, and then just sort of other things that DRC offers, like highlights and snapshots, and so on and so forth. So the first thing we're going to do is we are going to go to here where it says explore the data. And on the top, on the left-hand corner, you will see that there are, in addition to just surveying the specific indicators by year and kind of doing it on your own, there are some tables and maps and some snapshots that the DRC has already generated. So it's kind of up to you how you want to navigate this and what you are interested in seeking. So the first thing we will do when we are here is we want to select a year of data that we want to peruse. And so you will notice here that the data is presented either at 1-year intervals or in 2-year combined intervals. And it is best practice in research when using this data to use a combined 2-year data sets for improved accuracy. After all, these are sample data collections, and not everybody gets asked, these or fills out the surveys when they get them. So the more years that are combined in close proximity, like now the 2016-2017 or 2017-2018, the better the accuracy. So we can select 2016 here, and then what we can do is select the topics that we are interested in. So are we interested in child and family health measures, or are we interested in the grant measures? And again, the content map that I was kind of walking us through can be found here, and they are adjusted based on the data that we are looking at. So here is what we were looking at. Okay, so to get back to this, we can select measures. So let's, for now, explore neighborhood and safety. So these are the domains that we went over, and whenever you select one of them, the specific indicators that fall under them pop up. And so now we can look at neighborhood amenities. And before we do that, I just want to point out one thing for those of you who have a greater interest in how the indicators were formed and what factors went into determining the indicators, the age range for the populations that they cover, and so on and so forth. If you click on the eye, this information pops up. And so this information tells you the specific survey questions that went into this, if there were any changes, the numerator, the denominator, and all that other sort of geeky extra information. Okay, so now we can select neighborhood amenities. And the first thing that pops up is, just to orient us to this, is a table of the outcome of the information. Second, we can see the search criteria that we can play around with. We can change the state or region whose information we are currently looking at. So right now, what we are looking at is this indicator, does the child live in a neighborhood that contains certain amenities? And these include parks, recreation centers, sidewalks, or libraries. And we are looking overall at the national level outcomes. And so this is what this table represents. This is the percent that we will usually go with. To break down and try to understand the table that we are looking at very quickly, I want to point out that there's these 4 rows. And so the 2 bottom rows, the sample count is the number of people when the 2016 and the 2017 survey data was combined who responded to each of these categories, to each of these and responses within this. So if a neighborhood, if a parent or a guardian stated that the neighborhood of a child does not contain any amenities, these are the number of people in the sample who responded to this. So you can see that here. And then at the bottom, we have population estimate. So a population estimate means that the survey, that the sample was calculated and statistically sampled and moved up to the national level. So this number of the sample response is representative of this population estimate number. And so that is the case across the board. And that's why these numbers look very large and very different. Let's see. What's this next? Okay. And so the other thing that is important in the table for us to understand is the confidence interval. And so the confidence interval in this instance is at 95%. And so the reason why we have, and you will notice that the confidence interval provides a range and that the percent that we value, the estimated percent, is somewhere between that range. And the reason is because we are using sample level data to provide population level estimates about the entire country. We provide a statistical range for precision. And so this 10 to 11 provides a statistical range for precision. And so this means that if these surveys were conducted 100 more times, 95 times out of that 100, we would have 10.5 as a part of the percent nationally, or 10.4 as a part of the percent. So these are statistically tight outcomes that we are looking at here. And so in addition to the table, the other thing that we see are the graphs. And so the graphs are unique in that they are not just bar graphs, that they have these little things, these little whiskers, and these whiskers are a reflection of the confidence interval points. So here is 10.5 for a child does not live in a neighborhood that contains amenities, and the 10 to 11 is how far these little whiskers are going. And so they are handy for just kind of giving you a range for where the population estimates could be and where the outcomes are for when we did the calculation. Okay, so now the fun part where we get to disaggregate and compare the nation to states and at specific subgroup levels. So the first thing we can do is we can select a subgroup to provide these answers to. So for example, if we want to know if whether or not a child lives in a neighborhood that contains amenities varies by income level in the country, we can select down here the top right corner, and these are all the subcategories that the NSCH provides, or rather DRC's interactive query provides. So here we can select household income level, and we'll update, and we now have an updated table. And so you can see varying household income levels, and you can see at the top, like we were looking at before, the extent to which the neighborhood that the child lives in contains amenities. So I think it's not much of a surprise that maybe children and families that are living in, that belong to lower income groups. Maybe, oh, I guess that is interesting, that they do not have any amenities. Whereas if we look down here at the larger income groups, we can see that 46.5% of kids nationally who belong to this income group live in neighborhoods that contain all amenities. But I think it's positive to also note that perhaps there, children living in neighborhoods that contain all amenities is quite good, maybe. So that is what it looks like when we disaggregate by income, for example. And then you can also, oh, excuse me. Disaggregate by age groups, gender, and so on and so forth. And I believe each time we will get a table that reflects the data that we just pulled up. So this is the presence of neighborhood amenities for children 0 to 17 nationwide. And here are the 5 categories referring to neighborhood amenities and then the age group. Excuse me, I'm going to cough. Okay, so now the next thing we can do is we can compare this information. We can look at this information for different states, and then on top of that, we can compare states. So say we want to look at a different state, we can click down here, select the state we want to select, we can click Delaware, and now the information has information for Delaware. It's no longer national comparisons. So I think if you will keep anything in mind, note that this side will allow you to change the region, and this side will allow you to provide select a region to compare to that. So now this information is neighborhood amenities by age ranges in Delaware. And so this is what Delaware's population looks like. Again, we get the percent, we get the confidence interval, the sample count, the population estimate, and then of course the tables. The graph title that provides age range, the state you're looking at, and then the ranges with the whiskers, the confidence interval range for whiskers.
Let me just break in briefly here for a minute. This is David at Child Trends to say that those confidence intervals can be compared to margins of error, and as Fadumo was just showing us in the chart, when we now have state level data, these are based on much smaller samples because it's at a state level, and you see that those error bars, if you will, have gotten much longer than the ones we saw in the national data. And it's useful to have these because basically it means that if 2 of these bars overlap, there's not a statistically significant difference. So if we look at the first group of 3 bars, all 3 overlap with each other. None of those differences between the 3 age groups are significant. And I think if we look at just about all of these, for this particular indicator, if we look at all of the 5 groups of 3, each with 3 bars, none of these differences by age are significant. All 3 of the bars in each of the 5 groups cover at least some of the same ground, if you will. So this is a concept that some of you will readily glom onto. Others, this may be new to you, but it's a visual way of kind of getting across the idea of statistical significance. Okay, back to you, Fadumo.
Thank you, David, and thank you for pointing that out. Okay, so we have now looked at how to disaggregate the information by demographic characteristics, how to change the state, how to look at and interpret the information that comes out both in table form and in graph form. And then the final thing is we can compare states. So now we have Delaware, and if we want to compare it to Idaho, just select from this side that lets us compare. And so this provides a comparison between Delaware, Idaho, by child age ranges. But what you will notice here is that instead of having that long table, or rather that wide table with all the responses to neighborhood amenities, we now have a drop down. So this is a comparison of neighborhoods do not contain any amenities. If we want to look at neighborhood contain all amenities, comparing that, we just drop down, select, and then compare Idaho and Delaware again. So in the interest of time, I will wrap up and just let you know that if we go back to the interactive inquiry, and say instead of looking at family levels and characteristics, you wanted to look at the Title V grant measures, you can follow the same method and just, select, select, select. Or alternatively, what you can do is you can use the side here to look at the maps. So if we want to look at US maps that compare national performance, here they are. There's a list of performance measures, outcomes, and just selecting mental health treatment at random. Again, we can get a table, and then I think at some point, oh, should I select tables maybe? Okay, yes, I'm sorry, I took the tables. So here are the maps. So I think that is it for me. As just like last minute things, when on the website, I think I've went over it, you can request data, and that is right here. So I will wrap up and make space for any questions that we have from participants. Thank you, everyone.
So I thought that, I hope you guys got as excited as I did about this survey data and how you can use it. I admit I'm a little biased here. I want to remind you that the way you can ask questions is by using the question and answer function, which is in the bar, which may be at the bottom of your screen, although I think on Zoom it partly depends where you put it. But please do go ahead and ask our panelists some questions. And while you're writing them, I think we have one here, and I'm going to get to it in a moment. But I do have a question even before that for you guys. I know that it says state or region, and I believe the region are HRSA regions. You obviously can't get sub-state data online, but is there any way to get data that people break out in sub-state levels at any way? You know?
I can try to address that first. Do you just mean looking at states on their own?
No, I mean, for example, rural, suburban, urban, or looking at different regions within a state, or looking at different big cities within a state. Any way to break out the data inside a state? I'm guessing, I mean, clearly you don't know, but I think it would be really fascinating if you can find out, and I'd be happy to share the answer with participants later, with everyone who's on the
Yes. This is David. I can give you a brief answer. It's a question that we've gotten many times over the course of the past decade or so. The National Survey of Children's Health presently only presents reliable data, I would say, at the state level. But there is a resource that is available through this DRC site, and we can send the link to you afterward to the organizers, and they can share it with participants. There's some guidance on how to use a procedure called synthetic estimation, which involves taking advantage of what you know about the demographics, say, of the county that you're interested in versus and how that may be similar to or different from the demographics of the state as a whole to produce a more accurate estimate for a sub-state region. I won't go into any more detail right now on that, but that is a workaround that that some people may find helpful, but it's not going to have the level of accuracy as the state level estimates.
So if you send that to us, we will be delighted to share that with everybody who registered for the webinar. I think some people might find it helpful. We do have 3 questions here, and I'm going to go ahead and take them, but I can't help but point out in advance that for those of us who are working on the 2020 census, it's very exciting to see a survey that is using internet response and working well. And I wondered if you have any comments about how it's working and what that means for 2020.
Gosh, I wish I did. I haven't really heard any of the behind the scenes scuttlebutt on how well it's working, but it does seem from from the perspective of a user of sites like this portal that it seems to be working fine. But I don't have any inside information on what it took to sort of get the level of data that they were able to get. But fingers crossed.
Okay. So the first question for all the panelists is from Bill Burns. And he asks, when we are using data disaggregated by race, how do you recommend handling data that are deemed somewhat unreliable because of the smaller sample sizes of racial and ethnic subgroups? So I would imagine, Bill is from, Illinois. I would imagine, for example, he's interested in how you handle Native Americans, for example.
You want to take that, Fadumo?
Sure. So I think what we've done in our analyses is when you are doing the analysis, you can look at the counts and you can combine categories that are very small. So if you are looking to produce some sort of like statistical significance measure, what has worked for us and has best practice is to combine categories that are very small. Otherwise, when you are listing the outcomes, perhaps just like note that the population count is far too small to produce let's say statistical significance measures on. I think that's the extent of my knowledge.
Okay. Bill, if you have a follow-up, please put it in the chat box. We also have a question from his colleague Mitch, which is, do the demographics of respondents in a state match the state demographics of children? And I think what he's trying to find out is whether you, I cannot think of the technical term, but adjust, are they weighted is the word that I'm looking for here.
I believe that's the case, yes. This is a very rigorously designed survey. So I'm sure that all appropriate methods are applied to the data to make them as statistically representative of a state's population as they can be.
Okay. And then we have 2 questions from Helen in Maine. And I'm going to ask the first one, and then when you've responded, I'll give the second one. The first question is, I have been using 2016 to 17 data for many state questions. Is the set of questions markedly different for 2017 and 2018? Did they change questions a lot?
I don't believe so. During those 2 years, there was much, if any, change. But again, I would refer everyone to the website that we've just been looking at. And they again, especially if you click that blue, that I in the blue circle, that will give you all the kind of nitty-gritty details about any changes that might have occurred. But I don't believe there were any significant changes between 2017 and 2018.
And then her follow-up question is, can you go over again the data sets to choose from on the front page?
Sure.
So
just so I can take that. And just to add to what David just said, if you are interested in specific details about the method or the question list and the comparisons that talk about what has happened between the information collection years, The methodology documents for each year of data collection are available, and I'm happy to find the links and send them out to you all. And so the next question about choosing the data from the front page, yes. So if we just go to explore the data and then the interactive year that we want, sorry, the interactive data query itself, it lands us here, and here is a select year, a year drop down, and so these are individual years and then combined years. Is how you look at it?
And I believe that going forward, you will only have the option of looking at 2 years combined. Starting in 2016 and 2017, I think they were still working out a few of the kinks in the whole process, and so they rolled out those years separately as well as in a combined data set. But I believe from here forward, you will, for most purposes, you will want to use the 2 years combined. I think they may make the single year data available to researchers or anyone in the general public, because they may have a specialized need for a single year of data, particularly at a national level. But I think for most state level analyses, you definitely will want to use the 2 years combined.
And then I think Helen was hoping that you could actually look at the data sets that show the questions, which I guess is item 2, select a starting point. Can you show us that again?
You need to get to an indicator? Sure. So,
yeah.
So the structure at the bottom is the same for both. So since we looked at 2016, 2017, we can look at 2017, 2018. And so we just select that. We can start with a nation, because later we can always adjust to where we are. And then the child level measures or the grant measures, we can select from here. So the content map that I was discussing for a bit, here is what it does. So these were the top rows. So if you just have this handy on your desk and you were curious about looking at health status, you would know to go to physical, oral health, and functional status here. And there is oral health status. And so from here, you just select the indicator that you are interested in. So health status, here we are. And then here is the nationwide outcomes for, in general, how would you describe this child's health, which is the health status indicator. So if we wanted to look at another state, we can click here. It'll take us to another state. If you wanted to compare the nation to a state or a region, we can select this drop down on the right side. And if we wanted to look at health status by subgroups, we would select from the right-hand corner's drop down again. And the table as well as the graph.
Okay. And so that's how you compare across states or national to state. Do you know, as they have more years of data, if there'll be ability to look at trending over time?
Yeah.
Yes. As I said earlier, the National Survey of Children's Health has started out in 2003, but because of all the significant changes that happened with the redesign, users are definitely urged not to make comparisons of 2016 data going forward with data prior to 2016. There were too many changes both in the questions and in how the survey was administered to make that makes it a bad idea to look at trends going back in time that way. But you know, knock on wood, as long as things are able to stay on a pretty even keel and barring any further major changes, we will be able to examine changes over time going forward. And you know, already we have 3 years of data, 2016, 17, and 2018. And so there are plans, again, to release new data each year, although, again, the latest year being available now is 2017, 2018. A year from now, or slightly less, we'll have 2018, 2019 data, so overlapping 2-year periods. But you know, barring any major changes, that is one of the features of this redesign, is that it will allow people to look at trends over time.
And so this data is usually an early fall release. What's the release schedule?
Yes, I haven't seen a published release schedule. I think there are too many moving parts for them to sort of anticipate ahead of time exactly when. But if prior experience is a guide at all, yes, I think it's in the early fall that new data are generally released.
Right around Poverty Day and the poverty data too.
Maybe so. I don't happen to recall exactly when the latest data came up on this site. I mean, that's obviously it's somewhat independent of the other publications that you're referring to, Deb. But yeah, I think you have to keep coming back to the site and checking in that September period and see when it appears. Okay,
maybe I'll go back and look at their release calendar and see if they include it on there when they get closer.
Great.
That might be helpful for people to know. So
sure.
Those are all the questions we've got in the chat box. I want to give people just a couple more moments to think about whether there's anything else they want to know. I said this before, but I know we had a bunch of people jump on after we started, so I'm going to go ahead and say it again. I am so excited that this data is available. This is something I actually lobbied Congress and the administration for years with staff from Casey and with Chris Moore from Child Trends. And we did it because the original model only collected data every 4 years. And it also had a much more narrow range of questions it asked. And it's just so important to be able to measure data annually. And the key example of that was it was collected in 2007 and 2011, which meant that we had no data at all on child well-being from the depth of the recession. And this way we can really track how kids are doing year by year and see like what kind of impact economic downturns have or major hurricanes have, any one of a range of big immediate events that can have a big impact on child well-being. I think historically people had kind of assumed that indicators on child well-being just didn't move that much. But we all know that big events like hurricanes and recessions can move them. And of course, as policy advocates, we're in the business of trying to get big policy changes that can move them. So having the annual data is just invaluable. And I really want to thank David and Fadumo both for walking us through it so that we all know how to use it. We have not gotten any more questions, and we are and our time is actually up, so that worked perfectly. Thank you all so much for joining us today. We will send out the slides and the recording, and if you have any questions for our panelists after this, please send them to Jasmine at jadejones@foramericaschildren.org, and we'll include the answers to that in any mailing we do. And David, if you can get us that process for using substate data, we'll put that in the same email.